The other part of the central nervous system is the spinal cord. And the spinal cord provides two-way communication to and from the brain. It's enclosed within the vertebral column, and it's also protected by the meninges and the cerebrospinal fluid, just as the brain is. The spinal cord has peripheral nerves extending out from it. There are 12 pairs of cranial nerves that are going up to the head, and then there's 31 pairs of spinal nerves that are heading to different locations in the body. So here you can see spinal cord structure. You can see the spinal cord coming off of the base of the brain. Here you can see it's been cut through and you can see how thick it is. You can see those spinal nerves coming off of the spinal cord. And then here you can actually see the brain and spinal cord connected as one unit. Spinal cord injuries will interrupt the brain-body connection. And so depending on where the injury is going to determine what effect that's going to have on the brain-body connection. Because a spinal cord injury is basically a stop of that information flow. And the information can only go to and from that point. There's a difference between a lumbar puncture and an epidural. They both involve passing a needle between two lumbar vertebrae. The patient can be lying down or sitting up, but the purpose and specific procedure actually differ. A lumbar puncture is what's also called a spinal tap, and a lumbar puncture is a diagnostic test. This is obtaining a sample of cerebrospinal fluid between two layers of the meninges, between the arachnoid and the pia mater. And then that cerebrospinal fluid can be analyzed for infection, cancer, brain bleeds, autoimmune disorders. An epidural is a pain relief procedure in which medication is injected into the epidural space. This creates numbness from the umbilicus to the upper legs, but the individual can still feel pressure. And so this is often used during childbirth because it's going to create numbness, which is going to alleviate a lot of the pain, but it allows the female to still feel pressure so she knows when she needs to push to help deliver the baby. A side note with an epidural, my sister-in-law, when she was pregnant with my nephew, she had an epidural during her labor. And after she had the baby, she was experiencing these massive headaches every time she would sit up. But every time she laid down, everything was okay. And so what they figured was happening was that during the epidural, they actually punctured through the meninges, and that puncture was leaking cerebrospinal fluid, which is why when she was laying down, she didn't notice anything because her body was all along the same plane. But as soon as she sat up, gravity was pulling the cerebrospinal fluid down and it was leaking from where they had done the epidural. Sounds much more serious than it is because those meninges will heal. And so she just needed to make sure she was resting and laying down for a couple of weeks after having the baby so that it allowed her to heal without having those massive headaches. However, during this time, they also just wanted to make sure they did a CT to rule out any other issues that could be happening. And then they found out that she had a brain tumor. And so if she had not had this complication with her epidural, they never would have found the brain tumor when they did. Her brain tumor was in the frontal lobe. It was about the size of an egg. So Keep in mind your brain is approximately the size of two fists put together, and imagine an egg-sized tumor growing in your frontal lobe. So soon after she gave birth, once the epidural hole was healed, she ended up having brain surgery. And so they had to cut into her scalp. They had to remove a piece of the skull, and then they extracted the tumor. And so after the procedure, they then place the piece of skull that they removed back over the brain, and then they stitch the scalp up. And what they told her is during the healing process, she needed to wear a very tight cap on her head because you can't really put a cast on your head. And so the cap was just creating that pressure to help everything heal. She did say that as the healing was taking place, when the meninges were healing, it felt like she compared it to Rice Krispies in her scalp or in her skull as those were healing. And then also, whenever she would cough or sneeze, she felt like that piece of skull was actually going to like shoot off of her head because of the pressure that there was when she was coughing or sneezing. So, kind of a little side note with information about epidurals and frontal lobes and all of that. So then one of the other jobs of the spinal cord, in addition to helping to relay information, are reflexes. Reflexes are rapid, predictable motor responses to a stimulus, provides protective survival functions. So reflexes are your body's way of providing a faster action to a potentially harmful stimulus without having that information have to be routed up to the brain, which can take extra time. So this neural pathway is called a reflex arc. It involves the spinal cord and peripheral nerves. It completely bypasses the brain. The components of a reflex arc are the receptor, the part of the body that receives the stimulus, the afferent or sensory neuron that carries the information to the spinal cord, the interneuron, which is in the spinal cord that takes the impulse from the afferent and connects it to the efferent neuron, the efferent neuron, which is the motor neuron that sends a response to the message, sends the response message to the effector, and then finally the effector, the part of the body which will respond. So this is showing the components of the reflex arc. While the reflex arc is sending a response to the effector, a pain impulse is continuing to the brain. So the reflex response only goes to the spinal cord and back. So the reflex response occurs before the pain message is received by the brain, which means your body will react in a reflex before you realize that there's pain involved. You touch a hot stove and you pull your hand away before you even realize that it hurts. Reflex tests are performed as part of neurological exams, and the reason that they're performed is to diagnose the presence and location of spinal cord injuries. Based on what reflexes are tested and what response you have, that can signal if things are working properly within your central nervous system or if there could be an issue. Finally, developmental aspects of the central nervous system. The central nervous system is established during the first month of fetal development. Gender-specific areas will appear in response to the lack or the presence of testosterone. Hormones do have developmental impacts on brain development. Maternal exposure to things like radiation, drugs, or infection have the ability to harm the fetus's developing central nervous system. So, smoking decreases oxygen in the blood, which can lead to neuron death and fetal brain damage. Alcohol during pregnancy could impact brain development and result in fetal alcohol syndrome. Growth and maturation of the nervous system occurs throughout childhood, and this is especially noticed in myelination of neurons. So, this increases the speed and energy efficiency of neural impulses, mostly a postnatal process that will peak during childhood and then continue until early adulthood. The production of new myelin is still possible in adulthood as well. And if you're actively learning newer complex tasks or information, that can result in increased myelination in specific regions of the brain that are used in whatever task that is being worked on. Myelin damage is responsible for several neurological diseases, the most common of which is multiple sclerosis. Learning occurs through the development of additional synaptic connections between neurons, not by increasing the number of neurons since they're amitotic. Age brings cognitive declines, which is not significant in healthy individuals until they reach their 80s. And excessive use of alcohol can cause signs of senility unrelated to the aging process.